This video was created to review additional risks of liposuction surgery as well as the recovery process. You should first watch the video regarding risk of surgery in general, as well as the general considerations for post-op recovery before watching this one. Please follow along in your written consent forms and pause the video to write any questions you may have so that we can be sure to give you all the information you need in order to make an informed decision regarding whether or not to proceed with surgery. General information. Liposuction is a surgical technique to remove unwanted deposits of fat from specific areas of the body. This is not a substitute for weight reduction, but a method for removing localized deposits of fatty tissue that do not respond to diet or exercise. Liposuction may be performed as a primary procedure for body contouring or in combination with other surgical procedures. The best candidates for liposuction are healthy individuals of relatively normal weight who have excess fat in particular body areas. Having firm, elastic skin will result in better final contour after liposuction. Skin that has diminished tone due to stretch marks, weight loss, or natural aging will not reshape itself to the new contours and may require additional surgical techniques to remove and tighten excess skin. Body contour irregularities due to structures other than fat cannot be improved by this technique. Liposuction by itself will not improve areas of dimpled skin known as cellulite. Liposuction is performed by using a hollow metal surgical tube that is known as a cannula that is inserted through small incisions and is passed back and forth through the area of fatty deposits. The cannula is attached to a vacuum source, which provides the suction needed to remove the fatty tissue. In some situations, we use special cannulas that emit ultrasonic energy, laser energy, or a jet of water to break down fatty deposits. Depending on the amount of fat removed, liposuction may be performed under local, IV sedation, or general anesthesia. The tumescent liposuction technique involves the infiltration of fluid containing dilute local anesthetic and epinephrine, or adrenaline, into the areas of fatty deposits. This technique can reduce the time for surgery, blood loss, and postoperative bruising. Compression support garments and dressings are worn to control swelling and promote faster healing. Alternative treatments. Alternative forms of management can include not treating the excess fatty areas, diet and exercise, or bariatric surgery. Direct removal of excess skin and fatty tissue may be necessary in addition to liposuction in some patients. Non-surgical external heating or cooling treatments, such as CoolSculpting, may also be considered to reduce fat. Treatment with injections of deoxycholic acid to dissolve the fat can also be considered. Risk and potential complications are associated with alternative non-surgical forms of treatment. Inherent risks of liposuction surgery. Every surgical procedure involves a certain amount of risk, and it's important that you understand these risks and potential complications associated with them. In addition, every procedure has limitations. Your choice to undergo a surgical procedure is based on the comparison of the risks to the potential benefits. Although the majority of patients do not experience any of these complications, I want to make sure you understand the possible consequences of liposuction. Individuals with poor skin tone, certain medical problems, obesity, or unrealistic expectations may not be good candidates for liposuction. Liposuction in general. There is a possibility that large volumes of fluid containing dilute local anesthetic drugs and epinephrine that's injected into the fatty deposits during surgery may contribute to fluid overload or a systemic reaction to these medications. Though exceedingly rare, additional treatment, including hospitalization, may be necessary. Ultrasound, vaser, and laser-assisted lipectomy or fat removal. Risks associated with these techniques include the above-mentioned risk and the following specific risks. Burns. Energy from the above-mentioned devices may produce burns and tissue damage either at the location where the cannula is inserted into the skin or in other areas if the cannula touches the undersurface of the skin for prolonged periods of time. If burns occur, additional treatment and surgery may be necessary. Cannula fragmentation. Ultrasonic energy produced within the cannula may cause disintegration or fragmentation of the surgical instrument. The occurrence and effect of this is unpredictable. Should this occur, additional treatment, including surgery, may be necessary. Unknown risks. The long-term effect on tissue and organs to exposure to short-duration, high-intensity ultrasonic energy is unknown. There is a possibility that additional risk factors of ultrasound-assisted liposuction may be discovered in the future. We will now cover wound care and post-op recovery. Please follow along on your discharge instructions toward the end of this document. Please pause the video if you need time to find this document. Wound care. You may have a moderate amount of dilute bloody drainage during the first 24 to 48 hours. Replace your dressings as needed. Gently remove all Band-Aids and shower daily. Once you've dried off, please replace your Band-Aids. If you have external sutures, they will be removed 1 week after your surgery. The compression garment we give you should be worn at all times for the first 3 weeks after surgery, except to shower and to wash it. After 3 weeks, wear it for 12 hours a day for the next 2 months. Avoid tight clothing that could leave an indentation on the areas where liposuction was performed. Do not apply heat, such as a heating pad, to the surgical areas. This could result in skin burns. Swelling may be the worst at 5 to 7 days after surgery. Due to gravity, it is not uncommon to develop swelling and bruising in the genital area in the first few days after abdominal liposuction. This is not dangerous and will resolve on its own. To reduce swelling, you may use a small paint roller and lightly roll the surgical areas toward the heart for 5 minutes per area. Do this 4 times per day. You may also consider getting lymphatic massages. A responsible adult should remain with you for at least the first 24 hours after surgery. Call us immediately if you experience persistent or increasing pain not relieved with the pain medication, or if you have a high fever over 101 degrees Fahrenheit. Call 911 or go immediately to your local emergency room if you experience shortness of breath, sudden sharp chest pain, especially if made worse by deep breathing or cough, painful respiration, new onset of wheezing without any prior history, or if you experience a seizure without any prior history. We hope this video has been helpful, though feel free to ask us if you should need any further clarification. Thank you.